Tomorrow is my surgery. Yesterday I was preparing dances for the next week that other teachers can sub me, and I was showing dances, and right now I can barely walk. After that, I don't know how I'm gonna teach the whole day. I can dance even right now only like half middle level, so if I like really put a little bit of effort in my legs, that's it, it hurts the next day a lot. And I don't know why, when I schedule surgery, I have a lot of days when I really like show some stuff during the teaching, and then it hurts like hell the next day or maybe a week. Oh, and I start to worry that I maybe damaged something more. And also I worry about how I'm gonna feel after surgery, so a lot of worrying in my head. We'll see. Today is the surgery day, and the last 2 days I'm very nervous. I was so calm, and right now I understand that they're gonna go to my knee and I will have again that swelling feeling, pain feeling. I will talk to anesthesiologist and decide what I want. I want to sleep, because last time I was paralyzed like the lower part, or numb lower part of the body, and it was super cold. I was shaking all the time, and I heard how they screw my leg, so I don't want to do that again anymore. Maybe he will tell me that I will have better feelings after that, so if you sleep maybe it's worse. I don't know. I really don't want to participate during the surgery, and oh my god. And also I'm afraid what they gonna tell me, so what they gonna find out. Oh, I just so nervous that my stomach is going all the time like that. And I can't drink, so I'm very thirsty. Last time I could eat it was 11 p.m. and the last time I could drink it was 4 a.m. Right now it's 6:30 and I actually should go. Okay, let's follow me. Не вздыхаю, я снимаю дорогу. Yeah, so I'm waiting here for COVID test, and I was calling them, but they said that I need to text them, so I'm waiting for her to take test. I always breathe in the whole morning like this to calm me down, but it doesn't help. What really helps is a good talk with Dima, but he's gonna go to work right now, and I don't have any other options besides breathing. They're supposed to calm me down. Okay. That's my outfit. This blanket is warmed up. I can check here temperature. So I received that COVID test is negative. Then I filled out a lot of forms. Then I went to this room, changed, and then nurse checked my blood pressure, my heart rate, temperature, and right now I'm just waiting for anesthesiologist. We'll figure out which type of anesthesia I should have, and then I'm gonna have my surgery. It says that they're gonna do patellochondroplastic and also took a biopsy for MACI. Yeah, like that. I have OD initials that they will cut the right arm leg. Oh my god. Yeah, I have my initials on the right leg that they're gonna cut the right leg. Okay, so my surgery ended. It started around 8:30. I was asleep during the whole time. They finished at 8:50, so that was around 20 minutes. That's it. And then I woke up around 9:15. My knee is pretty big. Maybe it's not visible right now. I think it's not visible right now. So they said that I'm gonna probably forget everything that what I'm saying right now on the whole morning. So we need to buy prescription right now, and I need to take pills each 4 hours, do some elevation, ice, yeah, and they're gonna call me tomorrow and tell me. They said that my ACL is great. They said that I'm a good candidate for MACI procedure, and probably a doctor suggests me to kind of what he suggests, like to switch my bone, how bones
adjust your bone.
adjust my bones, that I don't have like that pressure that I have right now. Yeah, so hopefully insurance will approve surgery soon, that I can schedule it for the beginning of June, because I have plans to go for vacation in August, so I need to do surgery in June, that I have time for rehab. I feel good right now, but probably I will be in so much pain later. We'll see.
I don't think so.
We'll see. Oh, that's a good one. I don't think so. Yeah, I don't think so. Let's go. So what I'm doing right now, just resting, have my leg up with elevation, and I put ice packs on top. I have crutches here. For some reason I don't feel any pain. Maybe that's because of pills. They said that someone needs to be with me for 24 hours. Right now I'm alone, and I hope everything will be fine with me, but I feel pretty normal. Also, they said that I probably will forget everything that was in the morning after anesthesia, but I feel fine. I think I'm gonna remember that for sure. No, that's what I think. So, when anesthesiologist came, I said, please don't do me like a spinal anesthesia when the lower part is numb. I said, I want to sleep. I said, okay, you will sleep. I was joking during the whole surgery when I was not sleeping, so maybe that's because I'm nervous, but I felt like I'm like on a comedy club stand up show. Yeah, so that was kind of hilarious. And then I woke up, and when I started in the car, when I started to what I started to feel, that when my leg is low, it starts to bother me a little bit, because the blood is going there because of the surgery. So what I did, I just asked Dima to stop, don't go, and I went to the second like backward seat and put my leg like straight on the full seat. So that really helped me. First of all, during my first surgery on ACL, I had a big pain because it's like more complicated surgery. But overall, they didn't give me ice pack, I think, in the beginning, and also they didn't put my leg very up. It was slightly up. So what I think is good right now, that I really put it very high, for sure, higher than the level of my heart. I changed ice packs. I have pills before I start to feel pain, like a schedule. So that's what really helps, I think. We'll see when I'll start to bear my weight. They said that try to use crutches for a couple of days, and then start slowly increase weight. So yeah, but for now, when my leg is up, everything is good. I'm laying all the time, so I'm not dancing, moving, sweating, so I'm going to the toilet a lot. I think it was already 10 times, maybe a little bit less, but a lot. So today is the day after surgery. I just took 2 pills for reduce my pain. I didn't feel any, but just in advance, but they suggested me before to take pills each 4 hours. So I decided if I don't have any pain, I will reduce that. So I drink one after I came home, and another one when I went to sleep, before I went to sleep. I tried to walk without crutches. I think I'm gonna use crutches today also, because I feel that it starts to be a little bit uncomfortable. I don't want it to start to feel pain or swell more. Tomorrow probably I will try to walk without crutches already. we'll see. Doctor called me and he said that my cartilage is completely gone on the kneecap. Right now I understand why I didn't ask him what does it mean. It means that on my old kneecap I don't have cartilage, or I have a gap, like a hole until to the bone, so like inside. So maybe that what he meant, because what I heard about MACI, that you need to be like qualified. What does it mean? If you have like a really big gap, you're not going to be qualified. So if you have like a really wide space for that you need to cover with cartilage, but if you like in a third degree of cartilage damage, but it's not very wide, it's going like deep, you can do that. So I think that's what he meant, but who knows, I need to ask that. And also he said that I have 10 degrees shift in my bones, so I have like an angle that's really pushing. That's why my knee cartilage is always going away. And I didn't ask, and I understand it only right now, that is it because I fell after injury, or it was always like that? I think it's after injury for some reason, because after first surgery I felt that it's going like that feeling, and it didn't bother me, but then it starts worse. So probably maybe I shift my angle a little bit during the falling, and then it starts to scratch my cartilage, and I think it definitely became worse then, because during the first surgery they showed me cartilage, and it was cartilage, just like it was damaged, but not that big that he said right now. And right now I regret a little bit that I didn't start to do surgeries in USA straight away, because nobody said me that it's gonna be such a big issue. They said you need to fix ACL and that's it, and it was so much cheaper to do that in Ukraine. So what he said, that I need to do osteotomy, I think that's how it calls, tubical osteotomy. So they're gonna cut my bones in order to put leg into the right angle, that they're not doing that. And also at the same time they're gonna put that cartilage, so they already took a piece biopsy, and this cartilage will grow, and they will put this cartilage into my hole where I don't have any cartilage. But he said like it's pointless probably to do just MACI, because I have that part where it's pushing and it's gonna scratch. So what the point to do that? So he needs to switch angle in order not to push to that area, and then also put a cartilage on that area. And it's a very difficult process, very difficult rehabilitation. He said that he's doing only outpatient surgery, so I'm gonna be at home on the very first day after surgery. But he said that the first week I'm gonna be in a big pain, and I'm gonna be on crutches for 6 weeks. I probably will walk normally only where it's gonna be 10 weeks or something like that. And I have such a weird feelings and emotions, because it's a hard process, but there is not a lot of choices. He said that you already tried a lot of stuff, like PRP injections, stem cells, and if it didn't help you, probably it's just gonna get worse each year. And I'm only 25, so I need to fix that. He said that it's only 80% of chance that I will be able to dance on my competitive level, but it's better than not dance at all. So like I have a choice, but actually I don't have a choice. And I think he's one of the best doctors that I met in my life. He really makes me calm, and I really feel in my core that he cares about patients. He cares about me for sure. I read a lot of reviews about him, but it's not only about review. Just the first day when I met him, I realized that he's a great doctor. He also helped me deal with insurance and all that stuff. So I'm so grateful to find him, that I found him. I can't find where I should start to open that. It's very confusing. Where it is? Oh my. Okay, so this is my leg and I see blood. So I think it's all blood. I hope so. I'm not sure, is it supposed to be blood? Who knows? Yeah, leg looks like this. And I don't know, can I take this off or no? I don't have anything to change. So after I took this off, this is that. Oh, I'm very scared. Oh, yeah. Oh, wow, wow, wow. Okay, this is not bad. Oh my god. This part was bleeding. Oh wow. It's stuck. I think. Oh. Oh wow. This is my knee. Oh, that's so scary. I'm like a zombie. Compare. And this is definitely swollen, especially here on the sides. Okay, on this side. It's very swollen on this side. So scary. How am my knee supposed to look good after that? You know what? In Ukraine I didn't have stitches for this side part. I had only stitches here. Here they put just band and that's it. Oh. Wow. And here, look. It was so itchy to wear this band. Look at my leg. I'm like a crocodile here. So I put that on my leg. I have this from my previous surgery in Ukraine, and I think it will feel so much better than that. Yeah, they said that I can take it off on Friday. It's Friday, but I think it's better for reducing swelling if I'm gonna wear it while I'm walking. Guys, I'm so happy that I took off that bandage. It's so much easier to walk. It's painful like the same way as it was, but at least I feel my leg like when it's straight, when it's bent, I feel it normal, like normal size. With the bandage I felt that my leg is very huge and very stiff, and I really want to walk like that. Right now, yeah, I can walk like a normal person slowly, but yeah, it's still painful. It's actually more painful not in the inside of the knee. It's painful where stitches is, and maybe a little bit swollen. Yeah, it's not comfortable, but it's not like that kind of pain that you really like. Oh my god, what are the words for this pain? Like very straight, like inside of the knee that you want to jump like that. Yeah, I hope you got me. Okay, so guys, if you have the same issues when you're able to take bandage off, but make sure that you still maybe wear some sleeve or knee brace, and it's still like squeezing your leg a little bit, and this will help reduce swelling. If you are interested how my second surgery went, subscribe to my channel and don't miss my videos. Bye!